our psychology and film assignment, we watched Black Swan. This is being presented by Victoria Tillman, Ethan McGonagle, and Alison Andrews.
The film is seen through the perspective of Nina, who is a young adult modern ballet dancer living in New York. Nina is well in her 20s, but at the beginning of the film, her maturity is not one of an adult. Her room is pink, supple, and soft, not unlike that of a child's. She has childish mannerisms and immature views on life. She is completely blindsided by the sexual harassment that she experiences in the production of the ballet. Nina wishes to play the Swan Queen in her company's production and eventually gets the role. However, while she plays the White Swan perfectly, she plays a poor portrayal of the Black Swan. Her understudy Lily embodies the Black Swan perfectly, and this leads Nina to feel anxious and distraught. The film analyzes how far one is willing to go to achieve perfection.
Nina displays several symptoms of schizophrenia. Those who experience schizophrenia have difficulty distinguishing fantasy with reality and display disturbed behavior, thinking, emotions, and perceptions. Any cultural associations with the disorder in the movie can be assumed to be the same associations we hold in our society. For the role as a Swan Queen, Nina would have seemed like a normal, though slightly immature young adult. After casting, however, should Nina have visited a psychiatrist, she surely would have received a schizophrenia diagnosis. As a dancer, Nina is in the arts, whose profession contains a higher than usual rate of mental disorders, so it would not seem out of the ordinary for Nina to have one. In modern society, the majority of cultures would probably produce a schizophrenia diagnosis. According to an article written by Dr. E. Fuller Torrey on mental illness policy, the vast majority of the homeless population in the U.S. have some sort of mental illness. In some cultures, schizophrenic hallucinations may be seen as visions or premonitions. How the disorder is treated will differ between cultures. In the West, our society is generally more tolerant and sympathetic towards the mentally ill and will treat them according to the demands of the disorder. Although in the East, severe mental disorders such as schizophrenia are frowned upon, and in some cases will not be revealed to patients or family members, according to the Georgetown Undergraduate Journal of Health Sciences. This complicates treatment for patients. The stigma associated with schizophrenia is a blemish of the character for those who have the disorder and can lead those to develop a fear of those affected due to their behavior.
Nina's life is simple, safe, and controlled, but soon deteriorates after she earns the role as the Swan Queen. She begins to exhibit multiple symptoms of schizophrenia, a disorder that begins to manifest in adolescence or early adulthood, for which Nina's age falls into. On multiple occasions, Nina experiences hallucinations and delusions. For example, she sees her reflection in the mirror doing things she is not and hears voices when there are none. These hallucinations take a more disturbing turn as the play's production progresses. Nina's troubled thoughts also manifest in changes of behavior. Nina begins to use drugs and her behavior towards her mother quickly sours. In class, we learned that only 2 of the above symptoms are needed for schizophrenia diagnosis, and Nina clearly had more than 2. One symptom that was not expressed, however, was a flat affect. Nina's way of addressing others changes multiple times in the film. However, at no point does she develop a flat affect or monotonous tone. In other words, she was very expressive with her emotions throughout the film.
The proper treatment for Nina would involve medication and therapy. Her hallucinations are severe and indicate imbalances in her brain that only medication can truly help. That being said, an integrative approach would be more effective. The combined approach of atypical antipsychotics such as clozapine with cognitive behavioral therapy would probably be the best route for Nina. The medications would fix any biochemical issues occurring in her brain, while psychotherapy can address her hallucinations and distinguish reality from fantasy. In the film, Nina and her mother begin to develop a heavily strained relationship, and a lack of communication may prevent Nina from getting the care that she needs. Furthermore, her obsession with her role in the play will also interfere, as she would probably see treatment as an obstacle to attaining perfection. An ethical concern for treatment of Nina's schizophrenia would be potentially the lack of informed consent. Because Nina is so obsessed with the role she plays, she would probably resent her symptoms and refuse treatment for her disorder, leading her mother and other staff to force her into treatment. This would be a situational barrier, as it could hinder her from receiving treatment.
In general, the portrayal of schizophrenia in the film is relatively accurate. She experienced at least 2 symptoms of schizophrenia. However, we are unsure of how long these symptoms manifested, as no timeline was given in the film. One inconsistency could be in how rapidly the disorder manifested itself in Nina, as she began to exhibit symptoms soon after her casting as a Swan Queen. Nina's hallucinations seem somewhat realistic and grounded in relative reality. Nina's portrayal as schizophrenic embodies the frantic and erratic nature of the disorder, as well as the disorganized thoughts of a patient. The portrayal of disorders in the film can greatly influence our thoughts and beliefs on mental health by educating the public on how they manifest and are treated, leading to increased public knowledge and sympathy for those affected. Nina's desire to be the perfect lead as a Swan Queen was the trigger in her development of the schizophrenia, and ultimately led to her changes in behavior.